Over here. When I was about 8 years old, we went for a regular doctor's appointment, and then during the eye test, we stood far away. I covered my left eye, and I could see clearly with my right eye. And then I covered my right eye, and I saw pitch black.
She played soccer, she danced. She never gave us any indication that she had no vision in her left eye. It was just something that she just dealt with, and
I think she thought it was normal,
it was
right?
normal.
She's 8 years old and doing every other activity other kids were doing. The news came back. I think we waited for about 3 days, 4 days before it came back from pathology, and they gave us a call. I'll never forget the call. They called us and said that your daughter has a low-grade ganglioma.
I was very scared. Like, I know, like, when I heard that I had to go to the hospital every week to get a needle, it made me really sad because I had to leave school, and I would come back late.
Patients that end up having that BRAF V600E mutation in their tumors actually don't respond very well to standard chemotherapy. However, they respond very well to this targeted, so drugs that specifically go after that mutation. And that drug happens to be a pill that you take. So it's actually, from a patient's perspective, much easier than having a chemotherapy that has to be given through the intravenous.
It's better to stay home, and I don't like going to hospitals very often.
It shrank the first 3 months of treatment, which is typical in the type of tumor that she has in other pediatrics. So it shrunk about, we figure, about maybe 15%, which was great.
It's important, I think, to realize that the cancers that children get are not the same as the cancers that adults get. And so we really do need to develop a completely different spectrum of tests for those patients. And I think we've really seen over the last sort of 3 or 4 years at Sick Kids that adding this new information has really changed the way we're able to treat the patients. And I think in the end, it's much better for the patients to try and match the aggressiveness of the treatment to what we really know is how the aggressiveness of their cancer.
I'm happy where we are right now, but I was very day by day.
Now, you don't want to ask too many questions about, the prognosis long-term wise, but we feel really positive that she is going to grow up to be a successful young lady.
Like, I really want to be an actress when I'm older, to be like, I love the show The Flash, and I want to be like in the same show as him, but I don't know if that's possible.
I try to keep it on the ground.